Hello, I'm Professor Olivier van der Veken. I'm an ENT head and neck surgeon at the Antwerp University Hospital. I'm also the head of the department, and for many years I've been treating patients with sleep apnea, including the surgical treatment, more recently also using the hypoglossal nerve stimulation, such as the Genio device of Nyxoah. So obstructive sleep apnea is a highly prevalent chronic disease that often remains undiagnosed. There's up to 85% estimated in Western world of the patients that are undiagnosed. And if undiagnosed or untreated, this disease will lead to a high morbidity, leading to a specific obstructive sleep apnea related mortality that can be relatively high. Once the diagnosis is there, the classical treatment will often lead to a relatively low overall effectiveness, which once again underlines the need for alternative therapies such as hypoglossal nerve stimulation. The most classical treatment for an obstructive sleep apnea is the so-called CPAP therapy, which is an abbreviation for continuous positive airway pressure. And this therapy, if the patient has a good adherence, so if the usage overnight is high enough, then this can be highly effective. However, when we look at an overall group analysis, often the real clinical effectiveness in real life is lower than 50%, which once again gives a high need for alternative therapies. In addition, often when CPAP treatment is started and there's a low usage, then there's a big delay, a too long delay actually, to send the patient, to refer the patient for these alternative therapies and for the further assessment to see whether a patient fulfills the criteria, for instance, of the treatment with hypoglossal nerve stimulation. So the Genio device of Nyxoah is referring to hypoglossal nerve stimulation, while during the surgery there will be an implantation at the submental area where the internal stimulator will contact the protruding terminal branches at both sides, at the right side and the left side, which is a bilateral stimulation of these protruding branches of the hypoglossal nerve. After the healing in the postoperative phase, the patient will be able to put a patch each night which connects to an activation chip that will wirelessly connect to that implantable stimulator, and then there will be an activation with each breath of these hypoglossal nerve branches that protrude the tongue. This will then open the upper airway in the patient. The experience clearly illustrates that there is a high potential of this therapy with a significant decrease in the severity of obstructive sleep apnea, which evidently leads to a decrease in that morbidity and mortality and improves patients' quality of life. So this kind of investment will evidently give the opportunity to do even more research, to include larger patient population that can have a long-term follow-up, and this will, in the long run, lead to a broader access to this specific therapy for the patients, which is of utmost importance in terms of the morbidity and mortality of an untreated obstructive sleep apnea. So looking back at the experience that exists for more than 10 years with this specific therapy of the company Nyxoah, there is indeed a bright future, and that future will also be determined by the fact that there is enough potential of the further research and development. We do believe that the concept of hypoglossal nerve stimulation is promising therapy for obstructive sleep apnea, at least for the patients that don't tolerate or don't use the CPAP device enough. But there needs to be some fine-tuning, there needs to be some technical development, some research and development to make this therapy even more promising in the future.